connection?
We're live. I don't
Good.
think so. I'm gonna check it out on the lives. I'll
All
check
right.
it
Well,
out on Facebook.
okay. Hey, Dr. Deborah. Good afternoon. This is Dr. Deborah. I'm gonna call everybody doctor today because you all need to have your doctorate hats on. Dr. Lawrence Riddle, the chief advisor for the city of Flint. Suzanne Kupel, Dr. Suzanne Kupel today from the Genesee County Health Department, and Dr. Kay Dora. Kay, I've given you a whole lot of hats already today. I know you were you were on the board of health. You do something in your community, so you're gonna have to help us out with all of your titles. But we want to welcome all of you that have joined us today. This is our first live streaming Facebook Live. This is the day after Christmas. And on behalf of the Healthy Flint Research Coordinating Center, we wanted to kind of stay in touch with you. After 40 weeks of being on our webinar, we knew Friday was the holiday, and many of you probably would not have joined us on a webinar yesterday, but we wanted to stay connected because there's so many important issues that we needed to talk about. So today, have this great panel here with us to talk about, and we're just really going to talk right about the vaccine craze. I call it the vaccine craze because we've heard so much about these vaccines. I have tons of questions. I'm sure you have questions too. So we want to appreciate Dr. Deb for being our producer here today. And she tells me that you can still put questions in the chat on Facebook. Let us know what you're thinking. Help us to get through this conversation today. So I just want to start by going back and asking each of you, just for our listeners, to give us a little bit more detail. So where are you in the world? What happened yesterday? What's your role in community? And I want to start with you, Dr. Reynolds, because you're at the top of my screen. So Dr. Reynolds, tell us, day after Christmas, what's up?
Well, I am still physically distancing. I'm still being careful. I'm still sticking to my plan for guests. If you're not part of the folks who quarantined before and got tested before you traveled, you're not coming in. I'll open the door for you, and that's cool. Pardon?
You sounded real serious about that.
Oh, yes. And also, when you go home, 3 to 5 days after you arrive home, get tested again. So this is no joke. I'm not playing. And we'll talk about the vaccine later.
In a minute. All right. So Suzanne Kupel. Suzanne, you with the health department, and you could just, I know we're preserving our technology. So if you could just let us see you for quickly, just tell us what's your role at the health department and what happened yesterday?
So my role is Public Health Division Director at the Health Department. I service the Community Health Division, which does much of the outreach and education in our community. Yesterday, I had a very quiet day at home. I was on my own. This morning, I had an appropriate social distance conversation with my niece. We went to Starbucks and we had a car talk. So she was in her car talking and I was in my car talking, having a nice conversation. And then later this afternoon, I'm going to be delivering more packages to family and friends. So definitely doing all of my part to keep appropriately social distance and again, keeping everything down to my household.
Oh, that's awesome. Now that was a new idea. I hadn't heard about that car talk. They're sitting across from each other from the car. Good idea. Kay Dora, Dr. Kay Dora, tell us what happened yesterday.
Well, I had a very quiet Christmas, which is not like my usual Christmases. I have 4 sons. So we Zoomed and it was definitely different. It was a little sad, but I needed to walk the walk. I needed to not, go down and be with them and, expose them and have them potentially expose me. So I feel good. This won't last forever, hopefully. And we made it through this Christmas.
Awesome. Dr. Deborah, I know you're trying to navigate these cameras, but tell us what happened today.
I had a great holiday. I actually, I realized on Thanksgiving that I hadn't really done the work and the preparation to have the Thanksgiving that I wanted to have. And so I got real intent on having the Christmas that I wanted to have. So I had Christmas at my daughter's house in Baltimore. Me and the youngest daughter drove to Baltimore, and my daughter and my son were there. And he had been quarantining with her for about 2.5 weeks before that. And so I had the Christmas of my, not quite fully of my choosing. If I had my full choosing, I would have been with my whole family and we'd have been playing spades and talking stuff and all of that. But I had a Christmas that I could manage and that I could prepare for and that I know would be safe. The thing that really has surprised me is how many people I now know that have gotten COVID and the fact that I know several people that have died from it. That's been a real surprise. Um, and when I came here, I talked to so many people on the phone. I'm just in shock at how many people I know have gotten COVID. And the person that I just found out about is actually our center evaluated sister has COVID, Dr. Ronnie, her sister. And she has only been to two places in the last several weeks, the grocery store and Lowe's.
Wow.
She
Yeah.
hasn't been to work. Nobody's been in her house. She's only been to the grocery store and Lowe's once and got COVID.
Mm.
So we got to tighten up. We got to tighten up. And Dr. Reynolds is going to tell us a little bit about that, I think, and
Yeah.
what that looks like and how all of the different things we're doing are so important.
Yeah. It was different for me too. I've spent the last 9 years with my grannies. I had two grannies in Texas, and either they were here with me or we were out all gallivanting, the grannies and the great grannies. There's 14 of us, 16 of us went to Disney last week, for example. But this year was me and my two daughters, who we've only been the two of us. My daughter lives in Westland, so she's been talking to my house, and so she toggled to her house for Christmas. But we both on last Monday got the test, the COVID test, and both of us tested negative. And then it was different. My grandson wanted to come and visit, and so we had seen him a while, but it was like, you got to mask up, kid. And you sit at the table and you got your mask on. He even looked at me and he said, "Gran, you make me feel dirty." I said, "Well, I don't know where you been, so I got to put the mask on, and that's what we have to do in order to be safe." But it's a different world that we're living in. And so I just to start this conversation off about vaccines, it was different for a lot of people. Dr. Deborah, you mentioned that a friend of yours, very close that we know, sister has COVID. I got a message this morning that another dear friend of mine that I've known for many, many, many years, we sang together, we worshiped together, found out this morning that he passed away from COVID. I mean, so today, the 41st week of this conversation, we started it in March, on March 20th of this year, when I found out the first dear friend of mine that I'd known for most of my life passed away. So for me, this is very, very real. And so I wonder sometimes, I want to get into this conversation, which I call the vaccine craze, because there are 4 vaccines we're talking about now. We're talking about Moderna, Pfizer, J&J, and I hear AstraZeneca. What is up with the vaccines? And I know people are telling me they're taking the vaccine because we've got them in our community. But we need some help on this. So what do you think?
Well, let's approach this whole topic with some humility. Number one, we don't know everything right now that we may know next week or next month, and those things may change. We're dealing with a new virus, a new disease, and now several new vaccines. Uh, these vaccines have been through testing, but I want to put it in context because I'm a primary care pediatrician, basically. So I'm at the bottom of the food chain, but we have layers of protection that we need in this circumstance. And I got this idea from the Swiss cheese respiratory pandemic defense. And it's actually a diagram that shows the layers of protection like 10 slices of Swiss cheese between the virus and us. And the first 5 layers have to do with personal responsibilities. Let me repeat that. Personal responsibilities. And that is physical distance and staying home if you're sick. This next layer is wearing a mask. The next layer is hand washing and cough etiquette. The next layer is, and this is a challenge for me, avoid touching your face. And then the final layer of personal responsibilities is, if crowded, limit your time in that situation. So, in other words, if you had a plan to go somewhere and you arrive at the scene, and it just looks like chaos, disorderly, too many people, nobody wearing masks, as they say in the Cupid shuffle, back up and go home. Okay. Then the next 5 layers have to do with, it has to do with uh, fast and sensitive testing and tracing. And we are just getting to the point where we do have fast testing. And because we've peaked again, even though the situation is improving, we are still in a serious level for the state. We do need contact tracing. And then we have ventilation, and that's in public buildings and private buildings, doing as much outdoors as possible, and air filtration. Then the next level is government messaging and financial support. And I will digress and say that is probably our weakest link, but is my prayer and hope that in the near future we will have clear messaging and we will have financial support for the states to distribute the vaccine, and we'll have coordination. The next layer is quarantine and isolation. Now, so if you come in contact with someone with the virus, you need to go into quarantine 10 to 14 days, depending on the circumstances and how much monitoring is being done. And isolation if your test is positive. And that's for at least 24 hours after becoming afebrile. In other words, no fever without taking medication. And then the final layer is vaccines. So you have to have these for optimal protection and minimal risk. We need to have vaccines and all these other 9 layers so that we protect ourselves, we protect our family, and we protect our community.
So, Dr. Reynolds, you talk about these 9 layers now. I know there's much for us to do, and now we have these vaccines out, which is based on what you said. That's the last layer. That's the last layer. So all these other things we have to keep in mind. But it's something you mentioned that, even though the vaccines are out, does this mean that once people start getting vaccinated, we don't have to worry about anything anymore? I don't have to put my mask on or anything like that?
That's an excellent question. Nothing changes. All the things that we were doing before the vaccine, we should do after the vaccine. We are fairly confident, based on testing, that the vaccines will prevent infection in us and serious disease. We are not as confident that the vaccine will sterilize our airways so that we can't transmit it to someone else. So we still must wear the mask, do physical distancing, avoiding crowds, and those 7 other things that I mentioned. But
Yeah.
the vaccine is still a lifesaver. And I just want to clear up any ambiguity. As soon as it's available for me in Genesee County, I got 26,000 people ahead of me. I'm going to get it. I have a 92-year-old mother, retired RN. I'll be talking to her because, as Dr. Deb has said previously, you have to have a plan to get vaccinated. What we do today requires thoughtfulness, consideration, and planning.
So now you talk about that plan. I want to ask Kay, because you mentioned your mother is a retired nurse. That is something I do know. Kay is a retired nurse. She used to work in the hospital, and You had some really interesting questions about this. Hey, can you talk a little bit about some of the other questions that people, such like family issues, that might be important to have in this conversation?
Sure. First of all, I want to start with I am right in line behind Dr. Reynolds. I definitely want to get the vaccine. What I'm hearing from many people, and I wanted to kind of advance those questions, and I'm doing some research myself, but I want to listen to the experts, are about special health conditions. Now, we all know that some risk is involved in most of the things that we do. Like when I drove my car to work, there was some risk of car accidents. Now, I took every precaution. I'd wear my seatbelt and try to go the speed limit and things like that. But I figured it was worth it. I'm pretty excited when I see what the trials have shown so far about how low the risk is. But even having said that, I'm being approached by one person, a friend who has multiple sclerosis. And she's saying, I'm reading that sometimes the effects of the vaccine can cause you to spike a bit of a fever. With MS, if I spike a fever, that can exacerbate my symptoms of MS. I'm hearing from others who have autoimmune disease and saying, is this safe? And I think, we sort of have our ear to the rail. I'm still definitely on the side of yes, the benefit definitely outweighs the risk. We're hearing some allergic reaction type things. And I'll say that, people are being asked to stay after they get their shot, especially if they have some of those problems. If they have a anaphylactic response, that can be treated. So, and I'll be interested from Dr. Riddles what his thoughts are on that as well. We live in a different world now. I wanted to say one of the Christmas presents that I got from my husband was this finger pulse oximeter. Now, when would we do that for Christmas? It's a different world, but I think we all need to keep our ear to the rail. And I think what we're seeing with the vaccines is very encouraging right now.
Now, Dr. K. Dory, you threw one of those big words in there on again, anaphylactic. What did you say?
Well, I will defer to Dr. Reynolds to give us the real definition of that, but it's, go ahead, Dr. Reynolds.
Say the word again and then define it for me, Doc, because I mean, just kind of went over my head on that one. I think you need to unmute, Doc.
Anaphylaxis describes an acute, rapidly progressing, life-threatening reaction to some foreign substance. Okay, and you've heard about people who carry EpiPens around.
Yeah.
They have similar reactions. And so it can be trouble breathing. It can be a rapid pulse. Then it can be a drop in blood pressure. And so that's why people carry EpiPens around. So notice I'm saying this is not a new clinical situation. And the instructions are, if anybody has any reaction to any of the ingredients in the vaccine, they should let somebody know before they get the vaccine. Now, I'll be quite honest with you. I do not know every single ingredient in the vaccine. So this is a discussion you need to have with your provider if you have ever had a reaction. Okay, and this is not everybody gets these kind of reactions. But if you have had a history of reacting to a vaccine, you should definitely discuss that with your provider and sit around. And even if you've never had a reaction, it's critical that you sit around for those 15 minutes after the shot so that people can see how you're doing.
Thank you, Dr. Reynolds. Now, you're the medical doctor, pediatrician, particularly. I want to throw it over to the epi doctor, epidemiological doctor, Dr. Deborah, because I think the importance of this is the transparency. We don't know it all. And I've heard over and over again, this is a novel virus. It's a new virus. We don't know everything. So that's where the epidemiological process comes in to some degree. So, Dr. Deborah, if I'm off the mark here, you get me straight. But what's the perspective from your end as an epidemiologist in all of this?
Well, it's interesting. And Dr. Reynolds, we were live on YouTube. We weren't live on Facebook. We are. So it would be great if he could go back over the Swiss cheese analogy, because I think it really does speak to something.
You're asking me to review it?
You can now, yeah.
Yeah. Can you hear me, Yvonne? Okay, I hit the mute button by accident. Yeah, so Dr. Reynolds should review that. But the thing I'll say first is that um, uh, the work that we've done to flatten the curve, it worked, right? When we had provisions for people to be able to shelter in place, when we rolled out barrier-free testing so that people could get identified early and isolate if they were positive, or at least self-quarantine while they were waiting. As we started to bring the number of cases down and the hospitals were overwhelmed and oversaturated, we saw a lowering of the death rate. Like a lot of the things that we've done have worked. And so the way I always think of it is, if you plug a toaster into the wall and you put in bread, and then after a couple minutes, toast pops up. If you unplug that toaster from the wall, you're going to put bread in and nothing's going to happen. We've got to continue to do the things that we did that we know worked. Because if we unplug from those sourceful, powerful things that helped us to bring the numbers down, well, the numbers are going to start to go back up. And I think that's what happened. And I know everybody is, kind of over this, and they're wearing thin and all of that. And I just really think, from an epidemiologic perspective, people ask me things like, well, in the absence of this, or if we don't get a national mask mandate, or if we don't get a relief package, how many more deaths are we going to have? How many more cases? And my answer to them is, I would need a crystal ball to answer that question, because there's so many different variables, and so many of those variables are in our hands. You can't really say with certainty. All I can say is, we know what works. What we're going to have to do is do the things that we've done that we know worked to help us flatten the curve. Dr. Reynolds, I'll pass it back over to him, and think of it as all these pieces as being one layer of protection, one piece of the puzzle. There's no one thing that's going to solve it all for us, but collectively, these things will get us to where we want to be.
So, Dr. Reynolds, before you come, Dr. Deb, I just want to make sure, you said we were live on Facebook, but everybody couldn't see it. So we're at a point now where everybody can see what we got up. Okay. Yeah. I just got a text back. So, yep, we can see it live now. So Doc, what we want to do is make sure we're on the same page with this Swiss cheese analogy.
Oh,
because
yeah.
then I want to have some conversation with Suzanne Cooper from the health department, because there's some things put in place, but it only works if what we learn from what you're going to share with us will help make some sense out of it. So back to you, Dr. Reynolds.
Oh, yes. And our success is related to the vigilance and the hard work of our public health people, including our State Department of Health and Human Services, Dr. Caldoun, and our governor in instituting that shutdown after the Thanksgiving holidays, because we're starting to see a dip in the number of cases. So this is one slice in the Swiss cheese, and let's go to where the cheese is more yellow. On the bottom, it says government messaging and financial support. Okay, but that's just one of the 10 layers. If you look on your right side, your left side of the drawing, you'll see the virus trying to get to you. Okay, and just like Swiss cheese, when you cut Swiss cheese, not every hole lines up. So for the more cheese you put on there, the more barriers there are to the virus. Okay, and this was a brilliant thesis that was done by some Australian epidemiologists, and so wonderfully illustrated. So first you have physical distance. You stay home if you're sick. Then you wear your masks. Then you use hand hygiene, wash your hands, and cough etiquette. Then you avoid touching your face. And if you're in a crowd, you limit your time, because the larger the crowd, the larger the viral load, the more your exposure is. So if you go into a situation that's crowded and people aren't wearing their masks, back up.
Mhm.
Okay. And then there's the other level. That is, and that requires shared responsibilities with our health department, with our doctors, with our hospitals, and our clinics. And that is fast and sensitive testing and tracing. Now, because of some decisions we made earlier, contact tracing is really challenging, and different groups have had to be prioritized according to their risk. But now we even have apps for that on your phone. Okay. Then we have the issue of the physical environment, and that's the ventilation in the building, be it residential, be it a church, or be it a commercial building, that there's adequate ventilation, the system is working properly, there's air filtration, or you do it outside, as one of my colleagues just talked about earlier. And then, yes, it is government messaging and financial support. And I'm glad to say we live in the right state for this year. Okay. And then there's quarantine and isolation. So if you were in contact with someone who was positive, you need to go into quarantine. And the ideal period of time is 14 days. But if you are monitoring and testing appropriately, you may be able to cut that down to 10 days under direction and in contact with your doctor or your clinic or the health department. And then the final level are vaccines. And what I am saying and insisting is no one thing alone is going to do the job. So think of the Swiss cheese every time you get ready to make a move.
Wow. Okay. So thank you, Dr. Reynolds, because I know I got the note. Some people wanted to hear that. And I don't think we can hear this analogy too many times because it always brings something to us to think about that maybe we didn't think about before. And that's right now, Suzanne Cooper with the health department. Dr. Reynolds, you mentioned a couple times contact tracing and some of the other things that the health department is put in place, and we have an emergency preparedness plan. So Suzanne, we get a lot of questions about like where's the health department, how come we're not getting information, and that there may not be a plan. But you've informed me that there is an emergency preparedness plan. Can you talk about that for us so we all know what's happening maybe behind the scenes that we haven't been so clearly made aware of?
So every time we plan for an emergency, we're planning for something like this happening. It could be a pandemic in the case of COVID-19. It could be H1N1. It could be an anthrax attack in a community. There's a lot of different scenarios that we plan for in emergency preparedness. We had a plan in 2009, 2010 for H1N1 when we had to get vaccines into our community so that everyone could be vaccinated for H1N1. Those plans or structures are still in place. We have 6 school districts, 7 school buildings that we regularly work with that are points of dispensing sites or pod sites for when we have vaccine available. We've done site visits with all of those schools this fall. We've done lots of communications. We'll continue to do communications and plan in advance for when we have vaccine widely available in our community so that we can get it quickly distributed. And again, that plan's in place. Recognize that our immunization staff do immunizations every day. We have a structure in place for how we do immunizations. This is just taking that plan and putting it on the road. So we will have people at those pod sites ready to do immunizations when we have vaccine available. What we don't have control over and what we don't know yet is which priority groups are going to be organized, and that has changed and does change regularly. And we don't know how much vaccine and when we're going to get it for each of those populations. But the structure, that infrastructure is in place. We know we have a plan for how we're going to get vaccine out into the community, and we know who's going to be helping with that plan. What we don't know, and this is critical, is we don't know how much vaccine, We don't know which populations in which order, and we don't know what time frame. We know that it's available now and that our healthcare, frontline healthcare providers and others in hospital systems that are working with patients that have been exposed or have COVID-19 are getting those immunizations first. That includes our EMS providers, people who are delivering people to the hospital who are sick. We also know that the long-term care facilities that have the most vulnerable populations in our community are getting that vaccine first. Then we're going to move on to other populations.
So now, Suzanne, you mentioned that this changes, and I called you the other day, and I said, well, I just heard on I just heard on MSNBC that there's a shortage on vaccines, and they're just telling us they're out and announcing a shortage on vaccine. And you said to me, well, we didn't hear that yet. So one of the things you caution me about is sometimes the media gets ahead of direct conversations with the public health department. So I in the full transparency, and I'm really trying to be helpful, because God knows we need you all. But sometimes it's kind of hard when it seems like the messages are not clear. Dr. Reynolds mentioned that in the Swiss cheese analogy. So tell them what you told me when I said that to you.
So many times we hear about information that's changed at the same time as everyone else does through the media. Now, that information does change on a regular basis. And again, when we were thinking and waiting for the Pfizer approvals and for the Moderna approval, we all heard about it in live time. So you heard about it at the same time that everyone in public health heard about it. There's an organization called ACIP, or American Council on Immunization Practices. That's the organization that has conversation about vaccine and it advises for which populations should get it, what side effects might be there, what kind of precautions we should take for each individual vaccine. Those communications were live on television as soon as those conversations had concluded. So we're hearing about them in real time, the same time all of you are hearing that information. The challenge that we have is that there are changes that are being made. Recognize that there are 2 approved vaccines right now, one of which we know has had some allergic reactions. We've just now heard that Moderna's had allergic reactions. So things change on a regular basis. Many times, all of us are hearing about those types of allergic reactions in the news at the same time as the public health professionals. So we're all learning, we're all moving through all of this, but also recognize that things are going to change as we talk about delivery of vaccine. We didn't get as much as we had anticipated getting. We don't have control over that, so we have to adjust our plans based on what we get, when we get it, and then when the population conversations change. Who's going to be next in line to get vaccine? Those things have changed a lot.
Yes, Susan. So Suzanne, I get it. Yet it continues to raise those challenges for us in community. Dr. Reynolds, you said you next in line. 20,000 people before you, but you next in line. Kate, you say you next in line. Dr. Deborah, I don't know. Tell me. And I'm going back to this whole epi thing, because the other thing that I realize is when we talk about things changing, the data it's not real-time data always. It's 2 to 3 weeks behind. How do we keep up with it? Make sense out of all of this?
Well, there's a couple things. I have been telling people the CDC nothing miraculous happened, and somehow all the people at the CDC lost their good intelligence and brilliance. I will say I think that organization has been muzzled in many ways, and many of the great smart people that are there have not had the capacity to really do their job the way that we know they can do it, because we've seen what they can do and we've seen who they can be in times of crisis and public health emergencies. I expect that will be shifting pretty soon, and we're going to have a different director for the CDC, and a lot of people who've been, how they have like at the races and they're at the gate just ready to, I envision there's going to be a lot we'll probably see a lot more, and it'll be a lot more consistent, which I think will mean a lot for people. And so it is important that people stay up with the information. And the biggest problem that people say to me is, well, who is that? Where is that? And I always point them to our health department. I point them to the CDC. And I realize that none of those things are perfect. I tell people it's important to be in touch with your healthcare provider. And I'm also sensitive to not everybody has a healthcare provider. Not everybody has a primary care physician. So then I let people know, well, we have a federally qualified health center that's here to meet the unmet needs that people in our community have. So I don't think there's any one thing that's going to cut it. I think it's important to meet people where they are, to make sure that the trusted, credible messengers in community have what they need. A lot of our pastors have been stakes in the ground for getting good information out to people. I wouldn't even expect that anybody could possibly all on their own make sense. I can barely do it. And I got all kinds of, credentials in the space, right? But I think we have to just keep at it, keep going to those trusted and credible sources, and making sure that the people who have ready access to people in community have good information, because people do trust them. People do trust their pastor. People do trust their nephew and their grandson. So formats like this, where we've got people from the health department, where we've got physicians on, also I do think are valuable, because it is at this point about people being able to get the information that they need to act on it to keep their family safe. And that information has to come from people that they trust.
Yeah, I appreciate that, Doctor, because that's exactly why this panel is put together today. Because not only do you have the professional experience, but you have personal experience. And I'm really mindful that I can hear data all day long, but it makes a difference when I hear data from somebody that I personally trust.
Sure.
That I can challenge. Like, I heard you say that, but take it to the next level. Help me make it make sense for me where I live today. And that's a challenge. So when I kind of tease, I say, Doc Reynolds, you said you'd be next in line, because I really get it. When you think about your mother and you think about yourself, we're both in that. And I tell my children, make me feel like, I'm 65 is real, like, oh. But in their young minds, when they hear this conversation about vulnerable populations and that number pops up, it doesn't matter how maybe fun, loving, and acting I am with them, that makes a difference to them. And so to hear you today, I want to go back to the conversation again. I'm getting back to the vaccines. We've got two now that we know are in our community, Moderna and Pfizer. And please help us understand, you can't mix the two.
That's correct. And it's easy now because we only have two. In the future, we may have as many as 4 or 5. And I'll just say it this way. If you're going to get vaccinated, get the first one available. Unless you have a specific problem, do not say, well, I'm going to wait until the next brand is available. If you get the chance, get it, because COVID is not waiting. Okay? So they both require, the ones that are approved for emergency use authorization are the Pfizer, which is produced here in Michigan, and the Moderna vaccine, okay, which is contracted out to credible pharmaceutical companies. They both require 2 vaccines. And off the top of my head, I can't tell you. One is 21 days apart. The other one is 28 days apart. But as you said, you do not mix the vaccines. Get one day and then a different one 28 days later. You stick with that vaccine. And that's why part of the administration process is you give a contact number and a contact email, as well as there's a website where you can check. So you will be reminded to come in for your vaccine. They will have a record of what vaccine you received. You will have a card that says what vaccine you received and when you're supposed to come back, because this is serious business. And that's why I say you should have a plan. And if it doesn't work the way you expect, ask a question and ask questions until you are answered by someone who is intelligent. And if you can't get an answer, you look at our county website, you look at our state website, you look at the CDC website, and ask those questions again.
And Dr. Reynolds, I want to make sure everyone knows that when they get their immunization, it is in the Michigan Care Registry. So they do know exactly which shot you get. So you will get a card that you'll want to keep and have that available, but it is recorded so that if you don't have to remember which vaccine you got, they'll automatically know because they're going to check that before they give you your second dose.
So that's well, I know we're few weeks off now. So we know based upon what we currently have at our disposal that those persons who are in these high risk positions that are helping in this field are going to be the first in line. We, general population, may not have access to the vaccines until maybe late March or April. So it's really important for us to understand now what the process is and work toward following that process. Going back to what Dr. Deborah said, we got to have a plan. And I think that's the important thing. We got to have a plan. So it's helpful to understand what this process is. So I want to just bounce back over to you for a minute, Kay. I know I've given you a whole lot of titles here today. So you're in a position. You've been on our board of health. You've helped with a number of our community initiatives, even promoting public health as let me get it right, racism as a public health issue. And so we're not out of the woods yet with the links between some of these challenging other social issues and this virus and the distribution of vaccines. So what do you say in all of this?
Well, I think, there are a lot of platforms and a lot of things we need to keep in mind when it comes to equity and what groups are most impacted and things like that. It can't kind of stand on its own, just this, COVID. We've got to look at it in the context of racism, in the context of things that have been going on for a while, and kind of merge them all together. We have to be very mindful that I'm thinking of that last piece of Swiss cheese that I saw. We're talking about, the Swiss cheese piece a lot about the vaccination, but that government messaging and financial support. I will say I am encouraged, especially to see what Michigan is doing. And lately I've seen some things that are encouraging as well. That piece of the cheese, the government messaging, even on the local level. Just a few weeks ago, I served on a township board, an elected, official. We have to be mindful that what we do is serving as a model to other people. If we were to defy Michigan's orders and meet in person, what kind of message does that send to people? And I was very pleased to see, and I'm proud to say that our particular township did not, although there were people that wanted to meet, in person. Just within the last couple of weeks, one of the townships in the northeast part of the county decided to, in defiance, of the order out there from MDHHS, they decided to meet in person, and there was actually enforcement. And I don't think public health folks want to be in that enforcement position all the time, but when it's being defied, the protections that we know we need in place, and that's a model to other people, I think at some point you do need to enforce. And actually the Michigan State Police came out and shut down the meeting. So, and there are other businesses that are opening, in defiance with the orders. And they're also being, shut down. They're being fined. Sometimes their liquor license are being taken. I think we need to be that serious about this because, it impacts so many people. So I just think we have to, be mindful of all those pieces of Swiss cheese, do what we can do individually and, keep our eye on all of them. We can't only just wait for the vaccine. We've got to continue to do the other pieces.
Thank you. Yeah, because when we talk about our overall community, there's so many pieces to this. And Dr. Deb, you wear a lot of hats too. I'm going to come back around. I think everybody, as we prepare the closing session today, you're in all the hats that you wear, Dr. Deb. I keep hearing one thing that you've said often with one of our efforts, the Flint Center for Health Equity Solutions, and you say at the forefront. And I want you to talk about what that means, because in the context of this coronavirus, there's a whole myriad of issues. So we're in the forefront of the health equity revolution, if you will. So tell us about that.
Well, I think what we realized during COVID is that, I've been surprised. A lot of people really didn't understand just how extreme health disparities were. And then when you then go from health disparities, which are the differences that we see in health, and then moving people along a continuum to understand that there are things that are hardwired into our system, into our society, that actually make the playing field as far as health and opportunities for health unlevel and unfair. So we've got these baked in inequities in our system that prioritize some and marginalize others. And oftentimes that's based on things like race and income and age and existing health status and employment and education and where you live. A lot of times those are things that people sometimes can't control. Your average person has options about where to live. We'd all like to live in a Beverly Hills or a deluxe apartment in the sky, or who doesn't want safe, affordable, super great housing? Who doesn't want great, safe neighborhoods for their kids to be raised in and awesome schools? But the reality of it is the world does not afford that opportunity to everybody the same, right? And there's a lot about our history, and Case sort of started to point to it. And so I think when we talk about being at the forefront, one of the things I appreciate is the work of our local task force on racial inequity, which really came together around COVID. But we've got a lot of organizations and a lot of leaders in this community already in the conversation and doing the work for health equity and for eliminating health disparities. I think COVID has given us all an opportunity to see it for what it is. If you didn't know, now we know, right? And the other thing that we realized with COVID is that the work that we did that dealt with some of these real barriers that people face and having fair and equitable access to what they need to be safe and healthy, when you deal with those things, lo and behold, the disparities that we saw in COVID went away. So it's like, if we can innovate this quickly around this, highly infectious, communicable disease, boy, what could we do for the usual suspects, the diabetes and the hypertensions and other diseases? So I think it's really about, being at the forefront of what we call this health equity revolution. I'm just grateful to have so many in this community who get that. People who are maybe new to the party, but now they get it. It's like we got a new choir that's formed, and everybody knows all the words now. And now we're starting to sing in the same key. So it's really starting to come together, and I'm hopeful about that beyond COVID, because once we get through COVID, we've still got to deal with everything that we had going on before that.
Exactly. And Suzanne, I want to just really speak to what I know about what you and others at the health department have done in these partnerships. When we even talked about the pods that were being stood up for the testing, that there was intentional effort put forward to make sure they were located in communities where typically things like this were not available. Right now, the working with the state health department to be sure that in every quadrant of the city, there's a COVID tested site. And then even when this week, as an example, there was possibilities for the shortness of the opportunities because of the holiday, there was a special site opened up on Monday. So Suzanne, just a little bit about what really is in the thinking of those who are doing this work, considering what it needs to make sure that there's equitable opportunities for our communities during this crisis.
So you mentioned just trying to make sure geographically people have access, and we actually take a look at every week how many people got tested and where they came from to go to those testing sites, so we can map to see who's going to which location and what might be the best place for a pop-up testing location. We do that on a regular basis. When we work with the 7 school sites, we make sure that there's access to everyone, but we also plan for vulnerable populations. So think about, if you have a child with autism, it may not be ideal for you to get into a car and stand in line with your car for a few hours trying to get a COVID-19 vaccination. So we have special plans for those populations, thinking about senior citizens who can't leave their homes, thinking about other populations that may have English as a second language or may use ASL, American Sign Language, instead. We have to make sure that we are making the vaccine available to everyone and communicating about it in the language that they speak, or making sure that we are partnering with others who can help make sure they have equal access to the vaccine when it's their time to get vaccinated. So there's a lot of hard work that we do on a regular basis that goes unseen, just having those communications. We meet with our health threat preparedness group on a regular basis, and we have a subgroup for vulnerable populations and a subgroup for the schools. So we regularly communicate about what's happening, how to plan for these types of events, and making sure that we are working with populations themselves so that we find the best way to communicate what we're doing and making sure that there's appropriate access for everyone. So there's a lot of hard work that happens on a regular basis that people don't see. And it's not just during COVID-19, it's preparing for all types of emergencies that may come into our community.
Thank you, Suzanne. And I just wanted to take a minute. This is the after Christmas gift for for those who may not have had the opportunity to share with us before. There's a lot of work going on behind the scenes. Dr. Reynolds, I've had the privilege of working with you for we won't say how many years, but a number of years. but I will say
Those were just rehearsals.
I will say, but you've been tenacious in these last few months, particularly as you were before, but as the health officer for the city of Flint, and I think for all of us who experienced closely the water crisis and finding out that we didn't have the voice we had hoped to have for our community as a city, the role that you serve in is critically important to our community. You sit on a lot of committees and you're there always saying, on behalf of the citizens, particularly those babies. Now you have an
I
affinity.
say the residents. We're not all citizens. I say the residents.
Okay.
Equity.
And that's absolutely perfect, because we do need to keep that in mind, but the residents of our county. So I want to just give you a couple minutes, Doc, just what it really is like to really be that advocate, that voice, when you know you're the voice at the table when we can't be at the table.
Well, I'll tell you, first of all, I'm a graduate of Wayne State University undergrad and Howard University in Washington, D.C., which was formed. Howard Medical School started in the Freedmen's camps at the end of the Civil War when there was a smallpox outbreak. And we were always told, you have a charge to keep when you graduate. And yes, it's for our community, but our community includes everybody. But we make sure that the issue of equity is there. So they equipped, I was trained and educated and equipped to do these things. But let me add the other part. I have accountability. Everybody you see on this call is part of a network. So if something comes up, if I say something or do something and it's not accurate, I get a call from one of you all. If there's a question that has not been answered, I get a call from you all. So, I'm not the sole authority, but as part of a network with accountability, we make sure we get the messaging straight. And so that keeps me from talking off the top of my head, because if something comes up, I check with Ms. Cooper at the health department. I check with Dr. Deb. I check with you to make sure that I'm speaking in a way that everybody understands. And you always come up with those questions. Well, did you consider this? And Kay Dorr, who I've known since she was on the Board of Health, she'll pull my coat also. So people on this who are listening to this should understand we all speak to each other at least once, if not twice a week. So this is important. And because of the lead crisis that was, now 6 years ago,
Yeah.
because of that, we have made a commitment to improve our connection, our communication, and our accountability. And that is what has pushed Flint forward, plus all those initiatives that we have been working on the last 15 to 20 years. When Kay Dorr was working and focused on health solely. So, uh, I just got here, but and then working with our federally qualified health centers. We have two. We have Genesee Health System. We have Hamilton Community Health Network. And what I am most proud of is we have the Genesee Health Plan, where residents of Genesee County said, look, we are going to finance a project that will work on reducing inequity and increasing access and equity in healthcare. And we never back down from that commitment. So if you hear me running my mouth, I'm speaking for the folks who made this commitment.
Yeah. Thank you, Dr. Reynolds. I know we have the webinar every Friday from 12 to 1. It's a few minutes after 1. We had a few technical glitches on my end before at the start of the hour. So I want to thank Dr. Deborah for really finessing this. This is a new one for us. It's Facebook live streaming. Tell me what it is, Doctor, so I can get it right, Dr. Deborah.
We are live streaming on Facebook. We are not in the Zoom platform. We are actually in a different platform that allows us to go right to the live streaming. We're actually doubly live streaming on Facebook and on YouTube at the same time, which is great because the video gets memorialized. We'll send it out to people in our network. They can go back, listen, get some good, kind of information. I'm going to put Dr. Reynolds' cell phone number up so they can call him if they have any other questions.
No, you give him my email.
I just need to see if he was still on his toes or not. Yeah, but no, yeah. So that's what we're doing. We're just trying to be creative and really get to as many people as possible. And we didn't want to not get together because it's Christmas. Because guess what? COVID doesn't care that it was Christmas yesterday.
Right. And so, Dr. Deb, you bring us to a point where I can say again how much we appreciate the 45 plus partners that joined us every week. All of them didn't start off at week 1, but since then, as panelists, those pictures that come up when we do our webinar, those logos, there's somebody behind the scenes ready to answer questions from any of our residents that join us on the webinar. So we want to invite you to continue to support by your presence the webinars that are supported and hosted by the Healthy Flint Research Coordinating Center, which is a multi-institutional partnership. I can't say enough about the value of the universities who in Michigan are the rival universities, Michigan State and the University of Michigan, partnering with community to bring this work to you through the Healthy Flint Research Coordinating Center. All of the partners from the Greater Flint Health Coalition, the Genesee Health System to give us the updates on mental health, and the list goes on. We could not do this if you did not support us. Many members during the holiday, the thanks on cards that express their appreciation for this partnership for 41 weeks. I just want you to know, those of you that pay attention, we couldn't do it without you. We need you to continue to help us make a difference in our community. So we want to bring you another holiday gift next Saturday, the day after New Year's. We want to be back here with you. We want to let you know you can still get CEUs. For those of you that are community health workers, get continuing education units for viewing our webinars. And then we want you to like us on Facebook. Please subscribe, get that word out. Subscribe to our YouTube channel and help us grow this, where information for you, particularly here in the Flint, Genesee County area, but I'm mindful that people outside of our area are watching this as well. Join us email us at info@healthyflint.org, and we will look forward to responding to those questions. Let me again thank our partners today. Kador, who's been a longtime advocate and continues to advocate on behalf of Flint, Genesee County. Suzanne Cooper from the Genesee County Health Department. Dr. Lawrence Reynolds, who is a resident of the city, but also the chief public health officer advisor for the city of Flint, and my other partner here that we talk, as Dr. Reynolds said, we will talk late nights, early mornings to make sure that we're careful about what we share with you. But thank you, Dr. Dare, for pulling this live stream together. And for all of you that joined us today, we appreciate you. We hope that you will continue to stay in your little bubble. Because as Dr. Deb will help us to understand this week and next week, I've asked her this question over again: why is the delay in the data that it takes so long? But if we don't do the things that Dr. Reynolds suggested through that Swiss cheese, our stuff first, take care of our work first, and then let the vaccines come on board, we will never get out of this space that we're in right now. So we want to encourage you. Join us right here next Saturday for 1 hour. We promise you, for 1 hour, the New Year's conversation, and let's make it a great day. Last word from all of our panelists. Anything else? Did I miss anything?
Stay masked up, stay safe, social distance, wash your hands, and hang on. Vaccine is coming.
All right. Dr. Reynolds?
Don't forget the Swiss cheese. Remember, we have to put on the whole armor of COVID-19 defense.
Kador?
A new year is coming. The next time we meet, it will no longer be 2020. Hope is on the horizon. Stay strong.
Awesome. Dr. Deb, close us out today.
Yeah, I agree with my colleagues, and I want to let people know we actually did a pretty good job holding the course around Thanksgiving time. Our numbers actually are trending down. So I really encourage people, just stay the course. If we can continue to hold on the way we have, get through this season. Kay's right on the money. 2020 is coming in, and we have a lot to say about what that looks like. So just stay the course, people, and remember to be really good to one another. This is a tough season for many. Be good to yourself and be good to others.
Thank you all, team. We'll look forward to seeing you next Saturday, 12 noon, right here.
Peace out.
Love it. All right.
All right.